We'll talk about an important topic today, that is after 50 females and after 60 males. That is, usually after 50 years, females attain their menopause. Females attain their menopause, whereas after 60, usually there is something called andropause in males. Andropause in males. What is menopause? What is andropause? That means females actively have hormones, estrogen, progesterone, etc., etc. Estrogen is the hormone which is safeguarding females from most of the problems, even heart attacks. Up to the age of 50, 45 to 50, women usually don't suffer from heart attacks. The reason is estrogen. The reason is estrogen. Once their menstrual periods are over, that is they attain menopause, after the age of 50, slowly their problems start, their bones become weakened. That is, but in males, after the age of 60, after the age of retirement, slowly the problems start, like their bones also become weak, their muscles weak, etc., etc. How to prevent this? After 50 in females, after 60 in males, how to prevent this? Just follow me. Number one, you have to follow the same style. Don't have a feeling that I have retired. No retirement, please. You can retire. There is a chance of, for example, me, I am a doctor. I will retire. I will also retire it, but I have a late retirement rather. But during your work today, every day I work, round the clock I work in this hospital. But I started a navigation like this, like YouTube or whatever it is, so that whatever I know I am trying to teach you. Whatever I am doing, I am trying to share with you. Whatever I am doing, I am trying to share with you. I have crossed 61 now. In another 3 months I will be 62. So please try to understand that if you have retired, it doesn't mean that you stop all the things and sit at home. No, please try to have some avocations and continue the same style of functioning when you were in service. So do some work at home or outside, whatever it is, but safe work, comfortable work. You should mentally be very young, but not physically. Don't do youthful activities like young people. You must be mentally young. That's what I want to say. Please continue. Don't sit idle. Don't leave your exercise. Don't eat less. Stop taking food and all. That's not good. Please continue the same diet. Continue the good diet. Continue reasonable amount of exercise. That's what. So next comes exercise. So exercise is an important part of daily event. At least 4 days in a week. Minimum 4 days in a week you are supposed to do exercise. So my suggestion to all the elderly people is, if you are used to walking, okay, please walk. Generally, nowadays we are seeing accidents more. The roads are not that good. So I advise cycling at home or in an open place upstairs in your house, in your home. You can have an exerciser cycling. Instead of going for a walk, you better do cycling. One day cycling or walking. The other day, you try to concentrate on your total body exercises like push-ups and pull-ups. Like you have to do dips and sit-ups, squats, at least for half an hour. Daily minimum half an hour to 45 minutes exercise is needed. Keep up your muscle tone, because your muscles are likely to weaken, because after 60, because of this andropause, because of all your menopause or andropause, your muscles are weakening up. Keep them strong. That is called actually catabolism. Catabolism means your muscles are slowly weakening. Keep them strong with your good diet and good exercise. Number one. Number two, food. Food already I made a topic. What to eat for elderly, I made a topic. Already it is there. It is there in the YouTube. Please try. I'll try to tag it, but I don't have that much of competence, what I mean to say is in YouTube and all. My son will try to do that. But whatever it is, I have already made a topic on what to eat, elderly people what to eat, but I'll try to see that topic. Okay, I'll try to put it here. No, foods. So food mainly, so far, all these days, we have been eating rice, we have been eating wheat, we have been eating maida, we have been eating sugar, we have been eating jaggery. So my advice is, please try to come out of these 5 things. Please try to come out of these 5 things, because they are causing hyperinsulinemia, they are causing your BP, they are causing your sugar, etc., etc. Try to, 60 years is over, yeah. Try to come out of that. Try to come out of that. I have shifted 3 years back to millets and quinoa. Millets I take, breakfast I take, cooked millets, previous night cooked millets, in Telugu we call it chaddanam. Previous night cooked millets I take in the morning, breakfast, lunch, just millets, and night I take quinoa. Quinoa is full of protein, and millets is full of fiber, excellent fiber. So please try to shift from the regular 5 items to millets and quinoa. That is the best for your health. And next is, this is sesame seeds, that is till seeds, and this pali, that is groundnut. Eat sesame seeds. Our household, they will be making very good powders out of this groundnut and this till, that is sesame seeds. Try to have them one day groundnut, one day till in your regular diet, or you take one kira daily with this sesame seeds powder or groundnut powder, which is masala and all. They make with masala and all, beautiful, very tasty one, with ghee. Ghee is the best to have with them. Okay, I take it regularly like that. My snacks in the evening is nothing but kira with sesame seeds powder, that is masala powder, and or groundnut seeds powder, masala powder. Our people make it now. So eggs, non-veg you can take liberally. Provided, but if you are vegetarian, this is the best. These are the best. And for non-vegetarians, you have excellent eggs, non-veg. But only thing is, as when you are aging, when your age is advancing, people suggest, most of the people suggest that vegetarian protein is the best for your kidneys. Non-veg protein is also okay, but vegetarian protein is very good. Already, if you have a kidney problem, please try to take vegetarian protein. Next comes tests. What are the tests you are going to do? So this is, and here in diet, I will advise you to take, this is Nimbu Pani also, that is very, very, very important. Lemon, particularly 1 lemon in the morning, 1 lemon in the evening. Just try to have without sugar, little with salt. You can have some baking soda in it, super taste, okay, but no sugar at all. So try to have 2 lemons per day, okay, like water, lemon water. So tests, what are the tests to be done? Nowadays you need not go to a doctor for tests. Simply BP and sugar you can test at home. You have so many machines. BP and sugar you can test at home. So BP once in a week, sugar whenever you are in doubt. Or you can do it every Sunday. Like that is the best. And try, routinely we know we do cholesterol, triglycerides occasionally, once in 6 months, like that. Serum lipids. Say, what are the lipids? How are the lipids in serum? Serum lipids like HDL, LDL, cholesterol, triglycerides, once in 6 months is okay. And creatinine is one test. Serum creatinine is one test, which gives a good idea about your kidneys. You can get it done once in 6 months. Now, I want to tell you about one more test. These are our vessels. For example, take, this is the vessel. This is a blood vessel going to the heart. This is a blood vessel, this is the blood flow. So this is a blood vessel going to the heart. Already plaques are formed. These are plaques. Obstructions are formed. Already there are plaques. So these are soft. These plaques are soft. They don't do any harm. Only thing is, when calcium gets deposited in them, they become very rigid, and then the problems may arise. Sometimes it may rupture, and there a blood clot can come, completely obstruct the vessel. So please, there is one test called CT calcium score. CT means, CT scan. CT calcium score. CT calcium score is a very good test for all the elderly people to know whether they are likely to get a heart attack. Okay, very important. If the calcium score is high, if the calcium score is low, nothing to worry. If the calcium score is high, you can do CT angiogram. No need of big vessel linings. You have to put something like a small wire into the heart. No need. It is only an injection, and then CT. You can do CT angiogram, which is a very good test. Suppose one of our cousins has a heart attack, then it is better we also get it done, because cousins usually have similar lifestyles. Okay, please, CT calcium score first. If it is high only, then you can go for CT angiogram to know how are the heart blood vessels, whether clean or not. Okay, and next you have to go for number 5, constipation. Constipation is one problem which makes most of the elderly people suffer. That is a very bad thing. Never be constipated. Most important, you can take this kheera, fiber in the diet. Number 2, never suffer from constipation. Because of constipation, we are doing daily 1 or 2 cases of hernias, that is inguinal hernia, because of constant pressure at defecation. They are developing hernia in the right inguinal hernia or in the left inguinal hernia. We are operating them. All elderly people, above 60 people, please try to avoid constipation. Constipation should never be there. So please try to avoid constipation. There are so many things. You can use Cramafin syrup. You can use Dulcolax tablet 1 per day. You can use so many things. There is Agarol syrup. There is Dufelac syrup. There are so many syrups. Okay. And journeys. Next comes journeys. Only public transport. No two-wheelers, no cycles. Only public transport. See, use the public transport there, or if you can afford, cabs. You can go in cab, but don't go in any other method. See, auto is also safe, but two-wheelers, and they're very, very dangerous. We do 2 to 3 cases of orthopedic surgeries only because of two-wheelers. In elderly people, only because of two-wheelers and cycling. And of course, ours is a agricultural area. We cannot avoid cycle, because in agricultural zone they can only go by cycle. Okay, that is their problem, but I am talking to general population. Okay, right. Then journeys by public transport. Supplementations. What are the supplementations you have to take? Generally, vegetarian diet has some deficiency of. Vegetarian diet definitely is deficient in vitamin B12 and D3 also. D3, that is vitamin D3, that is these two are deficient. So please, you have to take supplements of vitamin B12 daily. Take 1 B complex tablet, Biplex Forte or Ginkgovit. And D3 also should be supplemented in both males and females if they are not sufficiently exposed to sun. You can take small dose, 0.25 international units of capsule Bio D3, BIO-D3. Bio D3 you can take. This is once in a week is enough. D3 once in a week is enough. B12, this is B complex, you can take daily. And next thing is, most important thing, particularly for females, you have to go to orthopedic surgeon, get this done. This is bone density, get that bone density test. If the Female is already having osteoporosis. That means the bones are weak. The bones are almost like marble. I mean, not marble, pingani. What we call it, ceramic tiles. Ceramic. Just the moment you land, it will break. Something like it is. Calcium is out of the bones, so it is very weak. Suppose this is bone density test. So once it is very low, your bone density is low, particularly females, they must take injection teriparatide. We call it osteoporosis. The bones are very weak, they don't have calcium. So you can take injection teriparatide, also called Bonista, for 6 months. I think they give injections once in a month. You have to talk to the orthopedic surgeon. Injection teriparatide, it's very, 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 very important to come back to normal stage, or at least 75% of the stage. So avoid fractures. Daily, at least 1 or 2 cases, we get this. These are called pathological fractures without any injury, without any obvious injury. You are climbing stairs, your foot is broken or leg is broken. This is called pathological fracture because your bone is not in a good condition. That's the problem. And next comes outside food. Try to avoid outside food. Okay. Alcohol. We don't restrict. 2 pegs per day or something like that you can take daily, night at bedtime. You can always take alcohol. There is no problem. Only thing is smoking. Smoking should be avoided. Smoking should be completely avoided. 60 years you have smoked, stop it, please. And then unnecessary things don't do. That's what is very important here. Unnecessary things. That means, see, suddenly you want to put a bulb. You want to clean the fan. Don't do that. Don't stand on a stool, start doing. No, this is not the age. After 50 in females, after 60 in males, never do all these ventures. Almost daily we do at least 1 case of hip injury. We do plate, we put a rod, we put a plate, etc. You become bedridden. Please don't do that. You are active, try to be active. See, follow these things. These are small things, but very, very, very important, very, very, very crucial.